Hello, everybody, and welcome to our webinar on good leadership and meaning better care. I'd like to welcome you all and welcome to our three speakers. I've just got a couple of housekeeping slides to run through, and really, due to the numbers, everyone except the presenters are automatically muted. During the presentations and so on, would you please use the comment or chat box to submit any questions or comments? We'll try and address individual points raised during the session's chat box, although we are admittedly expecting rather a large number of people today, which is great. We will be recording the session, and the recording will be uploaded to the website, after the session. And those of you who are attendees can switch on live captions for accessibility. If you're unable to access the chat, please email your comments and questions to me at verenawallace@nmc-uk.org. So, without further ado, I'd like to move on to the next slide, please. And we're delighted to have with us three of our leaders who've contributed to our work on this from the NMC. And we're just going to introduce them all, and they're going to tell us a little bit about themselves, and then we're going to move on to sort of questions as we move forward. So we've got Fortune Mhlanga, Paul Edwards and Shona Hamilton. So between them covering adult mental health and midwifery. So Fortune, could I move to you first, and if you just tell us a little bit about yourself, that'd be great.
Thank you. Good afternoon, everybody, and welcome to the webinar. So my name is Dr. Fortune Mhlanga, and I'm a mental health nurse. I'm currently working at Oxford Health Foundation Trust as a Deputy Head of Nursing and Quality. I have a history in clinical mental health work as a mental health nurse, as a staff nurse, working in community and inpatient settings. I've also done just nearly 10 years working in higher education as a lecturer and senior lecturer in mental health nursing before doing some work in governance, quality and governance prior to my current role. So I'm really looking forward to our conversation today and sharing insights and perspectives on leadership. I think one of the important roles that I really need to talk to you about today, which influences a lot of the work that I do, is my role as the Southeast Regional Lead for the CNO CMID, or Strategic Advisory Group for Black and minority ethnic nurses and midwives. But yeah, we can talk a little bit more about that as we go along. But thank you, and thank you for the opportunity to speak today.
Thanks, Fortune. Paul, can I come to you next, please?
Yeah, sure. Hi, everybody. My name's Paul Edwards, Chief Nursing Officer at Dementia UK, which is a national charity providing specialist nurses called Admiral Nurses to support people with dementia and their families. It's my 30th year this year in nursing, and when I qualified, I went straight into dementia nursing, and I've been around that for the last 30th years, and it's a brilliant field of nursing. And I suppose my career has been both in practice, about 10 years in the NHS, 10 years in academia, about 4.5, 5 years in the independent healthcare sector, and now sort of 6 years in the charity sector. So it's lovely to be with you today. Hopefully we'll be able to share some thoughts and ideas and interact a little bit more on the subject.
Lovely. Thank you very much, Paul. And Shona, your good self.
How are you? Thank you very much for the invitation to speak. I'm Shona Hamilton. I am a consultant midwife. I work in Northern Ireland in a maternity unit just outside of Belfast. Like Paul, I've got 30 odd years under my belt, so I've been around for a while. I have the joy of a lovely post. Not everybody knows what consultant midwives do, but it's a lovely post where I do some work still in clinical practice, work around service development and quality improvement, and then still have a role in teaching students and midwife. So it's a really very all-encompassing role that I suppose gives me lots of variety on a day-to-day basis. So yeah, thank you for inviting me, and I look forward to chatting.
And we're looking forward to it too. I'm going to hand over to my colleague Anne, who's going to take you through the rest of the brief presentation. Many thanks.
Thank you for holding the fort, Verena. Good morning, everyone, or good afternoon now. I am Anne Trotter. I'm the Assistant Director for Education and Standards here at the NMC, and I too am a registered nurse. We really want to get on to ask our really stellar panel about what leadership means to them. But just for the context, we have recently launched our campaign, Good Leadership Means Better Care, and we had reached out to a lot of professionals on the register to share stories and best practice about what that means to them and how that can support the teams they have. And ultimately, why we do this is for the people we care for and the people we serve. And bringing into that, obviously, is reflection and how our standards and code can support you in your leadership aspirations. Next slide, please. And this is not just about leadership for those who hold employment leadership roles. This is everyone's responsibility. So what the code tells us, what our standards say, that everyone has a part to play in this. And sometimes that leadership is about speaking up to advocate for people who are using the services or receiving care from nurses and midwives and nursing associates, and how the public can be encouraged to raise concerns if they have them, and how those in your teams can be supported. We know it's often a challenging landscape for people today, and pressurized environments have been almost normalized. So how do leaders support teams during these challenging times? We know that we've got a long way to go in terms of racism, for example. Racism is in our society. So how do we create those inclusive working environments for people across the diverse range of our register? And inevitably, how do we bring those new students who are so keen, so ambitious to be the professionals of the future? So how do we support students? How do we support people coming in from internationally to work in the NHS and social care? And how do we make sure that those people stay within the workforce? Next slide, please. So what we've got is a few questions, but to kick us off, I have one question for each of you. So for Fortune, Paula, and for Shona, giving you a couple of minutes each on this. We could talk all day, everybody knows that. But what does good leadership mean to you? And how does it lead to better care for people? So I'm going to work in reverse this time. So Shona, I'm going to come to you first.
It's a really important question. And it's a really important question to reflect on. So it was really interesting when I was asked to do some of this work. I was just starting on the old path of revalidation and thinking about reflecting and thinking about your own leadership styles. And sometimes I think when we talk about leadership as nurses and midwives, we think about it almost in managerial terms, don't we? We get lost in what is managing and what is leading. And sometimes I think we work in a very hierarchical system that makes us all believe that other people are leading and managing and that we're not. And so it really gave me the opportunity to think about what is it that I role model in terms of good leadership, and what is it that we enhance in practice in terms of being a leader. And I think one of the key things that came through to me was that as you build your career, as you move forward, you focus on your own skills. What is it that I can do? What is it that I have? How do I move forward? And actually one of the greatest reflections was, how do we enhance the skills and the leadership of midwives and maternity support workers and people actually providing the care? And to me, good leadership is about ensuring that that happens, ensuring that the people who give the care on a day-to-day basis have the skills, the knowledge, the framework, the leadership, the compassion to do that and to do it safely. and thought a little bit about that psychological safety and how important that is to provide the care on a day-to-day basis. So I think leadership, to all intents and purposes, is about role modeling, and it's about giving other people the empowerment to challenge, to advocate for women in our care, and to challenge me and to challenge others in that leadership arena as well. And I think that's something that we need to really work hard on moving forward, is how do we enhance our workforce through leadership in order that we get really excellent care that we want and that people deserve.
Thank you, Shona. And you're raising some really important points. That challenge, it shouldn't be seen in a negative way, I guess. It's more about, this is part of what being a professional is, that you question, you challenge, you seek to constantly improve. Thank you. So Fortune, same question to you. In approximately 3 minutes, if you can. What does good leadership mean to you, and how does it lead to care for people in your experiences?
Yeah, thank you, Anne. Yeah, just to echo everything Shona has said, and adding on to that, for me, leadership is about facilitating the creation of an inclusive environment. I think that's really important. We talk about, having effective teams. We talk about having shared goals, shared values in our organizations. How can we do that if we have within our teams people who don't feel like they are part of the team, people who don't feel included, people who feel like they're others? So for me, for us to be good leaders and to meet the challenge that we're faced with at the moment in our healthcare sector, we need to start with creating those teams. And why it's important is because, apart from the shared values, shared goals, working towards the same aims and objectives, which ultimately lead to better patient care and patient experience. On top of that, I think in terms of the economy that we are in now, the economic challenges, we've got areas with high staff turnover, retention challenges. And I think a lot of that, if we create those inclusive teams where people feel like they belong, then that can help to improve that picture. I was reading on the NMC website, actually, one of the insight reports, and just looking at some of the feedback that comes through from staff, it shows the paramount or the central role that the relational aspects in the workplace actually plays. So you see things like where people feel like they are not listened to or they are treated differently. That really has a huge impact. And where our staff don't feel valued, they don't feel respected, they don't feel like they are part of that team, then that has a negative impact on patients, whether it's to do with the high staff turnover, shortages of staff, or what Shona talked about, that psychological safety. Now, we know that research has shown that where people feel psychologically safe, they are more likely to report even when they make errors. And it creates an environment where we can learn from near misses or from errors, and we improve patient safety and we improve the quality of care. So for me, that inclusion is really, really important. And as a leader, it's something that I strive to work with, the people I work with in that very inclusive way. I'll just say one last thing. I mentioned earlier that one of my roles is Southeast Regional Lead for the CNO and CMIDO Strategic Advisory Group. That has really opened my eyes to the impact on people's well-being where they don't feel included. So where people don't feel included, it doesn't have just a psychological effect. It's also got an impact on their physical well-being, where people end up with physical health problems because they feel excluded in the workplace. So for all those reasons, I think as leaders, we really need to look at the relational aspects within our teams and foster that, help to foster an environment of inclusivity.
Thank you, Fortune. And you raise a lot of points, and I know we'll come on to that when we start talking to you specifically about the things that you talked about during the campaign. But certainly we do exit interviews or an exit survey when people decide to leave the register, and they can fall into two categories: reasons outside work, I'm about to retire, for example, to reasons within work that has led them to make the decision to leave the register. So a lot of the things you say resonate with those findings too. So Paul, last but not least, before we get into the detail of each of you, 3 minutes, please, if you can. What's your reflection what does good leadership mean to you, and how does it lead to better care for people?
Yeah, happy to do that. Two great responses, I think, actually. So I'll try and add to what my two colleagues have said, because I think they were just really helpful responses to the question. I suppose for me, thinking about leaderships, it's kind of more broadly, I suppose the thing I think about is, how do we help others to achieve? You know, how do we lift all boats in the harbour, or whatever the phrase is, rather than just us. So I think that's important. We've got you know, a bit of a tradition in nursing to sort of eat our young and eat our colleagues sometimes, and so how do we move away from some of that thing? You know, how do we raise the confidence and the support for our colleagues in nursing? And I think leadership is about that, because if we don't, then that's risky for not just our colleagues and what they do and the profession, but also for our people that we serve. So I think that's important for me. I think leadership is about building confidence in people's practice and them feeling good about what they've achieved, and making sure that, you know, that confidence then is passed on across the workforce. You know we can't deliver nursing and midwifery on empty. You know, we know that people need a certain amount of support, and we've just mentioned about that psychological safety for people, which I think is really important. But we also need, I think, you know, nurses and midwives to be constantly topped up with support, so that they, you know, their levels of energy and confidence don't sort of reduce by too much, because that's quite a dangerous place for nurses and practitioners to be in. So part of being a leader is to keep an eye on that, I think, and make sure that we do put in place those systems and structures to make sure we do top people up when they need our help. Certainly my experience in dementia care when I qualified was that I saw a lot of nurses that clearly hadn't had those environments around them, who were really distant from the patients that they were supporting, and there was a lot of poor care, but also very unloving care and very dysfunctional relationships across teams and across structures and across cultures of nursing. And I suppose leadership is about keeping an eye on those things and making sure that we don't sort of slip into those kind of cultures of poor care. And part of that is making sure our teams feel good about the work they do. Yes, great challenge, but also high levels of support as well. So I think there's a few things to add from my perspective, Anne.
Thank you, Paul. And that a couple of you have already mentioned psychological safety and checking in, so not doing it once, but doing it regularly to make sure that staff have that opportunity to say how they're feeling, and often even knowing that if someone says, I'm fine, does fine actually mean fine, or does it mean something else, but they just don't want to go there? Or you're normalizing when people feel unsafe to be able to speak up about things. So Shona, coming back to you, you obviously talked a lot about this during the things that we're launching through the campaign, and you have started to talk about the importance of midwives showing leadership and absolutely advocating for the women in their care. Can you explain to our audience why that is so important, and to do it continually, not just occasionally?
Yeah, and I think, and one of the key things for me is because we talked a bit in the campaign about how pressurized services are and how pressurized the clinical environment is, and how we're busy on a day-to-day basis, and everybody's busy on a day-to-day basis, and it feels like, you know, sometimes we're on a conveyor belt almost, doesn't it? That you know, the work never stops. And I suppose you know, sometimes if you reflect back on yourself, sometimes, you know, when you're trying to make your way through the day as a health professional, trying to organize care for a woman, link with other health professionals, how challenging we find that as professionals, sometimes in a really difficult, complex system. So sometimes what is really useful to do is pause and try and figure out, well, you know, as health professionals, we're finding it difficult. How difficult is it for women and patients who we are serving? How challenging is it for them to articulate their needs in the middle of busy clinics and busy clinical environments? And I think that's where we, as midwives and maternity support workers, need to pause and say, what is it that we need to articulate on behalf of this woman or this family or this baby? And how do we help them get the care that they need and the support that they need, and how do we signpost them to other people? And sometimes that's hard, and it ties into all of it, doesn't it? As Paul said there, you know, when people are tired and they've been busy and they haven't had a tea break and haven't had a cup of tea, you know, how we can feel drained in that, and it is hard to continue to motivate. And I suppose there was another bit in all of that, Anne, that we talked a bit about feedback and how positive feedback is, and utilising feedback mechanisms like great text and care opinion, where actually when you pause and say, you did a good job today, that woman was really appreciative of your care, that was a good catch, and those sorts of things are really important.
You raise a really good point. It's not just about focusing on the things, perhaps for all of those challenges, people find they're doing less well. They want to do more of it, but often find they can't. But taking the time to give that positive affirmation about things that are going well. And it goes back to the point about being a learning culture, not a blame culture. So inevitably, though, Shona, we get all the, you know, the when thing goes wrong headlines. So how do you as a leader encourage midwives to speak up and feel safe in speaking up? So not to be in the negative space, but to be in, we could do this better, or we could learn from what colleagues are doing in another part of the maternity service or in another trust, for example, in Northern Ireland.
It's really hard, and I suppose everybody would appreciate at the minute that maternity services certainly seems to be in the spotlight, and certainly there's a lot of negativity around it, and midwives certainly pick up on that. I suppose one of the key things, and that we need to do, is keep reinforcing the concept that it's about learning. But I also think, Anne, that this system needs to reflect that we need to reflect that. There was, you know, a great saying, recently we were doing some QI, it says, you know, I know we don't want to apportion blame, and I know we don't need to know who was involved in the incident, but if you could just tell me their name anyway. You know, there's this notion that sometimes, you know, what we say and what we do and what we project isn't really necessarily that concept of psychological safety. So I think it's about reinforcing. I sometimes think what is really useful is, you know, I do some clinical supervision with some specialist midwives, and what I find is really useful is to actually I've started those supervision sessions with health and well-being and reflection. And sometimes that's the opportunity to say, okay, so, you know, we had an incident, this is what happened, let's reflect on what the learning is, and really reinforce the learning rather than the negative aspect of it, and not buy in to some of that negativity. But that's a whole system change, and that's a perception change, and we're not going to do that overnight. But I think if we all, you know, quietly as a team, and I find our team are very positive about learning, and I suppose it's about, as you know, Fortune said, it's about those shared goals. If our shared goal is about a learning environment, then we can only but build on that.
And I mean, you raised that important point, and it's been mentioned in the going to segue beautifully into Fortune, that professional role modeling and learning from our mistakes, because we are all human. We will all make mistakes at some point in our career. So moving on to you, Fortune, you talked about inclusive environments and creating that space where everyone is welcome, be they professionals, be they the people in our care. But clearly, we know from our own register, our register is changing. So how do you focus particularly on providing support to the internationally educated professionals on the register when they're joining us? You know, they've called to the action for us wanting more nurses and midwives. So how do you enable them to support that transition to different ways of working, but also having the strength to be inclusive, to speak up when they need to, and to learn?
Yes, thank you, Anne. Yeah, I think, you're right, the register, and over the last few years, we've had quite a lot of new registrants who are internationally educated. And in my role as SAG lead, I've had the privilege to hear more about the experiences of our colleagues who are joining us from, different parts of the world. And I think having those insights, having that understanding, and having the curiosity to hear, listen, learn from colleagues who are coming from other places. Because one of the things that we hear a lot is about, previous experience not being recognized. That's one of the things that comes up quite a lot. And I think as a leader, if you take the time to get to know who's working in your service, who's working in your teams, what are their strengths, what are they bringing, if they're coming from abroad or from elsewhere, what is it that they're bringing that we can tap into to maximize benefit for colleagues, other staff, and also for the patients, because they come with such richness and a wealth of experience which we wouldn't get just working in the environments that we're working in. So we need to actually value that and have that curiosity and interest in tapping into it as leaders. And I think if we role model that, and again, going back to that otherness or othering, if you're role modeling that inclusivity, valuing the difference, and showing the richness that others coming from different places brings within the teams, within the services, that will be replicated, and it will change the experience of internationally educated colleagues, but also the experiences of the diverse populations that we are serving, because the populations we serve are also coming from different walks of life, diverse in many different ways. So being able to have that curiosity to get to know and understand, I think is really important as a leader, and also to foster that within the teams that we're leading. I also think in terms of supporting internationally educated nurses, it's preparing the teams that are receiving internationally educated nurses to be ready to work with people who are coming from somewhere different, because I think sometimes we can focus on preparing the internationally educated nurses to come and work in a different culture, but when they arrive, they also need to come to teams and services that are ready to receive them. And in terms of their own preparations, so for example, I work in mental health, so I know that just even from understanding about mental health treatments and things like that will be different in different parts of the world because of different cultures and beliefs. So taking that into account, and really supporting colleagues to learn about the way things are done here, the culture in this country, whilst also learning about their cultures as well, and meeting each other halfway, I think is really important, and not expecting change to come just from one side. I think it has to be coming from both sides, and there has to be that willingness from both sides to learn about each other. So those are my views about the internationally educated nurses. Thank you, Anne.
Thank you, Fortune, because you're raising such a good point. We live in a multicultural society. And that will be different in Northern Ireland, Shona, to what it might be in London or the South where you are, Fortune. And my neck of the woods in Scotland will be different, but it doesn't mean that it's one size fits all, and it doesn't mean that it's just about those colleagues who have taken up the call to action to come and work in this country have to make all the adjustments. We do need to think about that because our population is diverse too. And you're right, mental health and the way that that's perceived across the globe is very different, in the same way that I suppose, Shona, pregnancy and care of women during pregnancy is very different across the globe, and midwifery is different across the globe. So, there are all those adjustments and learning we can gain from one another, to be perfectly honest. And then, Paul, when we come to you and think about, and I've seen some of the comments in the chat thinking about not only that diversity, but that care and how that care spans community, acute care, social care, local authority care. So thinking about it, Paul, with you, how do you as a leader, knowing that dementia, people with dementia and their families affected by having loved ones with dementia, that care can be fragmented, but how does leadership of our professions help to manage some of those situations?
It's a brilliant question. I think there's a few things. The first thing is, I think what we ask nurses and midwives and nursing associates to do is really complicated and complex, and in my field in dementia care, things can be really complex too, and helping families who are struggling to navigate or get the right care and support or receive that often falls to nurses, and nurses feel that they receive that from patients that they're caring for. And actually, if you don't put any mechanism in behind that as a leader to help them with that, then actually all you can see is just these major, complicated, difficult situations that can feel like just such a big burden psychologically for your nurse. And you can only cope with that for so long, I think, without something breaking or something snapping, which is why having the right kind of mechanisms of support, supervision, reflective practice around your practice is helpful. This is a safety critical workforce, right? We wouldn't have our planes taking off unless the pilots were well rested and well trained and well supported. And yet our own profession, nursing and midwifery and nursing associates, are we putting the same kind of thinking and conditions in place to really help people through those difficult times? It's not a straightforward job, any of our work. It's full of complexities and challenges and really difficult emotional situations, as well as clinical situations. So why do we expect nurses without those kind of cultures of support and inclusivity and compassion and all the things that we talk about? Why do we expect nurses to be able to do their job without those things in place? And I think, if things like clinical supervision are optional, then I think we've got a problem. Because it shouldn't be optional. It should be part of that mechanism to support best practice and clinical safety. But very recently, and we saw it through the pandemic, people have been really struggling to deliver the care that they want without the support that they need. And that leads to things like moral injury and all those other, really difficult ethical and emotional hazards that we face as a workforce. And actually leadership, I think, has a really big role to play in really acknowledging that and putting in place the stuff that sits behind it. And that could be just, one nurse to one nurse having a great conversation and a reflective practice, supportive kind of thing, or it could be a much more structured approach. But if we don't do those things, then, we'll be letting our planes take off without the right safety equipment, right?
It's an analogy that's used a lot, isn't it, that as a safety critical industry, and people worry about calling nursing and midwifery care an industry, but it is a safety critical part of our work. And we've got a lot to learn from the aviation industry and how they deal with critical incidents and serious event reviews to ensure that, those planes are safe and the pilots flying the planes are safe. So, there is a lot we can still learn from those businesses and how they approach it. But before we get on to the questions, because we really want to get some of the audience questions coming in, I just want to summarise some of the key points that I think people are on the panel are bringing in, and it's kind of resonating across all three of you. And am I surprised by that? No, not at all, because you're all leaders in your field, and you've thought very carefully about this and closely about this in your day-to-day practice. So the psychological safety is coming up loud and clear. I think that freedom and safety to speak up, that freedom to learn, and not just about what we do well, but being open to the possibility we may have made a mistake, and how can we all learn from that. Curiosity has been mentioned too, being curious, whether that's about professionals joining our register from outside of the UK, or whether that's about being curious about new and different ways of working. Thinking about clinical supervision is coming up a lot, and we do get lots of questions about clinical supervision, and we talk about reflection and where that comes in, but we don't necessarily speak specifically about all the benefits of clinical supervision, which are so tremendous if people can access that. So Verena, I've seen the chat box lighting up quite a few times since we've been speaking. Can you begin to pose some questions so that we can start getting some of those rich answers and responses and reflections from our panel?
Yeah, absolutely, Anne. For some of them, I will sort of condense maybe two questions into one. But one of the questions that came up that was around, Lucinda sent it in, is to all of you, about what barriers do you feel there are or what barriers do you feel there are in current society that prevent good leadership from being carried out, and how do you feel we as leaders can prevent or overcome this? So this is about barriers in current society that prevent good leadership, and it may well link into a question that's slightly further down in the chat box, which is around, do you think there's a sort of default which is about blaming leadership when things are going a bit awry nowadays, and that there is also a huge workload and responsibility that is increasingly landing with leaders, and they're at risk of burnout as well as the staff that they lead. So that sort of, again, links in with the psychological safety aspect. So, Anne, I'll hand it over to you.
Thank you. Thank you, Verena. You haven't started with an easy one, have you? It's certainly one that gives us all pause for thought. But thinking about those aspects, there is a lot of accountability and responsibility that lies with being a leader in any organisation. But what do you see the challenges and the wider society things? I think some of that is in the context of, we know that people are living longer, we know that people are living with complex needs and comorbidities, and we know that there's a service that's under duress, yet there's a tremendous amount of trust in our professions at the same time, but people are maybe not getting access to the care at the time that they would like it. So I'm going to come to you, Shona, for any reflections on that. And Fortune and Paul, you can start preparing too.
It's a really difficult one, Anne, isn't it? Because I think there's something there about, the weight of responsibility for running services and providing healthcare, and sometimes we talk a lot about how ineffective our NHS and our services are, which does one of two things. It instills lots of fear into the public, and sometimes it can be quite demoralizing in terms of staff when they're doing quite a good job, and yeah, I suppose the reflection is, yes, leaders and managers feel the weight of responsibility in more recent times, in terms of, the reason why the system isn't working is because people aren't leading and managing it effectively. And I suppose there's a wee bit of a dichotomy there in terms of clinical practice and leaders and managers, because sometimes actually the front-facing staff, the staff to all intents and purposes who are the cold face, sometimes feel actually they're the people most likely to be held responsible for when things don't quite go as they should, or the service isn't quite as it should. And I think there's something about us all learning to be honest as a service and a system, to say, yeah, we're not always getting it right. And some of that may be about leadership, but you know, the NHS is one of the most complex systems in terms of service provision, and I sometimes think we miss that. It's messy, it's difficult, it's hard, and I think if we can just kind of start that honest conversation amongst ourselves, that we don't always get it right. And I think it goes back to that leadership bit, where I think not only we're asking clinicians to be brave in terms of mistakes, but I think that goes further up the system. It's okay for us all to say, we didn't get it right, and let's all be brave. So yeah, I think there are challenges. I think lots of people are feeling like they're being held to account, and maybe in a negative way, but I think an honest discourse about what our service looks like and how we make it better is probably the best way forward.
Thank you, Shona. Fortune, I'm going to bring you in to answer your reflections on that, but Paul, I might save you for the next question so we can get another question in. So Fortune, please. Obviously in mental health, different challenges, not exactly the same, but advocating for the people in your care is crucial, particularly when people are very vulnerable, as they often are.
Indeed, yeah. So when I heard this question, it just got me thinking about different things. And the first question that came to mind was, who is a leader? Because I think sometimes when we think about leadership, we think about the people whose job titles hold, you know, lead off or head off or director, where in actual fact, leadership should be at all levels. And I think thinking of leadership in that way helps us all to share responsibility, so that no matter what the challenges that are coming through, expectations from patients or from, you know, from wherever, whether it's to do with targets, commissioners, wherever it is that we are getting some of those pressures, if there's that joint ownership and everybody plays their role and they lead in the areas that they are working in. So if you're a healthcare assistant and you still see yourself as a leader, it means if you have new ideas, if you're thinking about how things can be done differently or better, you feel you're able to do that and lead in that way. So I think for me, one of the main things that I've been reflecting on is, who is a leader and how can we all recognize that we are all leaders? You know, it doesn't matter what our job titles are. And then the second thing that I thought about was interdependence. And it links into the first bit, because whether you're a manager or director of a service, you can't deliver without the work that's being done by someone from estates, someone, you know, the cleaner, someone who, you know, works in the quality improvement department. So there's that interdependence, and recognizing that we can't work independently. We can't be, you know, holding the mantle and the responsibility and accountability. We are interdependent, and recognizing that and ensuring that that is felt throughout our organizations. I think that can help to kind of ease some of those barriers and unblock some of those blockages that sometimes come up when responsibility or accountability lies with certain nominated individuals. So if all of us see ourselves as playing a part, and that this person can't do their role without the next person, and all of us are parts of the jigsaw and it will not be complete without all of us being there. I think that's really important. And the third thing I thought about was about expectations as well. So Shona, you mentioned something that I think is really important: being honest, being authentic, and being transparent, because I think sometimes some of the perceived barriers or the challenges that we face sometimes come from a place of people having expectations that can't be met, and sometimes it's from a place of not understanding the situation and circumstances. So that openness, honesty, and good communication, I think, can help to, it's not going to get rid of, of all the barriers and issues, but I think there are things that can come from that communication, honesty, and transparency that can help to ease some of the challenges and the barriers that we face as leaders, and those pressures sometimes that we feel when we see ourselves as being where the buck stops with me type of thing. So those are the reflections that I had when I heard these questions. Thanks, Anne.
Oh, thank you, Fortune. I mean, we could be talking for hours and days, not the 1 hour that we've got, Fortune and Shona and Paul. And we keep coming back to some of these main themes: psychological safety, giving people the time and the space and the freedom. You also brought in things in relation to, it's been part of a team as well, and that team includes the person that's taking round the cup of tea, who might have those little private moments with, and then can feed that into the grand scheme of things. But Verena, there are so many questions coming out. What's next, please? And we'll be coming to you, Paul. So listen carefully.
Yes, absolutely. This one is a sort of combination again of a couple of questions around communication and around concerns and escalating. So there's one around the sort of idea of how do you communicate concerns around staff behaviour, professionalism, and the example was given of, people completing assessments or not completing assessments, and then challenging poor care when perhaps agency staff have come in, or thinking about following up on when safeguarding issues have been closed, but you've still got concerns, and they've been closed by somewhere further up the line. And I think that sort of ties in with a couple of other questions that also pick up on the sort of psychological safety that has to be there for the learning and the learning environment and the learning culture. So sorry to sort of pass you a smorgasbord of questions, Anne and Paul, but over to you. Paul, over to you, please.
Yeah, I mean, I'll try and sort of bring it all together if I can, because there's a lot to unpack in that. So some of my research has been in whistleblowing, and particularly whistleblowing in dementia nursing and across social care. I'm trying to understand why people do and don't speak up about those things. What are the barriers to speaking up? And there's lots of research if people are interested in that area. And I suppose the few things that I've sort of learned in my career is, first thing is, we talk about whistleblowing, but what we actually mean is doing the right thing. And so sometimes taking that big label away about, I've got to speak up or I've got to whistleblow. It is, what is the right thing to do in this situation, and making sure that people know that that's okay to do the right thing in the right situation. So that's the first thing I was thinking about. The confidence to be able to do it, is actually, leaders have to set the culture in which that confidence can really, really flourish. So, and I think that's important. So that the moral leadership, if you like, by leaders is really important, and that's quite a bit of work that I've been working on in my own personal development over the last sort of 15 years. Is what is that culture that I need to put in place so that people can speak up on the back of some very serious issues such as mid-staffs and all the rest of it, thinking about why nurses weren't able to do that, or where they took those concerns. So I think it's up to the leadership to be able to put that culture in place, to be able to say it is fine to talk about this. It is fine to speak up about this, because one of the things from the research is that whistleblowers are really worried about what their peers are going to think, what the peers are going to say, and actually trying to take dismantling some of those cultures is absolutely important for safety, but also if you think of our code, what we're supposed to do, how we're supposed to act on behalf of the safety of our patients, if you don't create the right infrastructure and culture for a nurse or a student nurse or a nursing associate or a midwife to do that, then they're not going to do it. They're just going to be frightened to do it, and then they get really stuck morally in that space of, I know I should do this, but I can't do this. How do I do this? So I think it certainly for the next 10-15 years, we as leaders, however we're defined, need to do a lot more work on that kind of mechanism and infrastructure in our organizations to make that a perfectly normal, natural thing to do. And I don't think, if I'm honest, that we're totally there yet.
No, you're raising such important points, Paul, and I think it's that notion, if someone becomes a leader and has a badge that says that they're a leader of something, then there's a kind of like, well, that's it, you've done it, you've got everything, all the tools and the toolkit, all the knowledge behind you. But actually, none of us can ever have that. And it's how we grow and develop. I'm very conscious of time. Verena, I'd really like to squeeze in one last question. There's so many things and we may not get to everyone's question, but one last question so that we can have a go at that one.
Absolutely.
Please.
This is around education and clinical supervision. And the question was, are there any sort of leadership models or frameworks that will help from your perspective to educate, train our nurses as future leaders to provide better care? And we did have some suggestions around compassionate leadership and the work of Michael West in the chat box itself. And there's a sort of segue from that, which is around leadership in learning disabilities. And while we have learning disabilities in the examples on our website, there's also about that visibility side of it. But the key point is the leadership models, frameworks, and clinical supervision, and the education of the nurses going forwards.
Thank you, Verena. And obviously people with learning disabilities are in maternity services and midwifery care as well, Shona, and we couldn't have everyone represented on our panel, but we can put other webinars out there and can think about maybe having another webinar to conclude our campaign on leadership and bring some of those other, I'm a children's nurse, but there's no children's nurse leaders being represented on the panel either. And that's the thing about our professions, it's so diverse, it crops up everywhere in society, our professions, so trying to get that representation is not always there. But focusing in 1 minute line from each of you on leadership models, education in and around being a good leader, any tips, any clues, what's your go-to resource? Shona, then Fortune, then Paul. Go-to resource, please.
There's lots of models out there. I'm going to tell you, Mike, and I talked about this during the campaign. My go-to resource is finding yourself a mentor, finding yourself somebody that you admire, that you've seen as a positive leader, you've seen as a positive role model, and that has been, since I started my consultant midwife post 12 years ago. I have a go-to person when I'm feeling challenged, when I'm not quite sure what to do, who has some of that expertise, and who isn't afraid to challenge you, and you aren't afraid to be challenged by them. And I think that's my greatest piece of advice to anybody. There are lots of frameworks, lots of ways of doing things, but sometimes that positive one-on-one is hugely beneficial to your leadership, and I've learned a lot from that.
Such wise words, Shona. Thank you. You know, we are not islands. We're not all in this alone. So, Fortune, one piece of advice or go-to resource from you, please.
Okay, so I've got a couple, and so for me, Michael West, definitely, I really like his work, and I've learned a lot about compassionate leadership and what it looks like from him. Also, Amy Edmondson, she's done a lot of work around psychological safety and how teams that feel psychologically safe have just and learning culture, which is what we're trying to foster in our different services now, is that no blame, but learning from mistake, learning from incidents. So I have listened to her audiobook, which is helpful. And also on Twitter, Helen Bevan, she posts lots of frameworks for leaders and lots of ideas around leadership. I just follow her on Twitter and just read her updates. So those are the ones that I listen to.
Perfect. So more than one for colleagues listening. Hopefully that's helpful. Paul, one or more resources?
Okay.
Go for it.
So maybe I'll tackle the clinical supervision kind of models and stuff. So one of the models we use is practice action learning sets to support that development of clinical supervision. There's a lot of information about there, but they seem to work for us in terms of developing the space for clinical supervision to happen. So that's one thing. The other thing I would say more broadly, because I agree with all the points actually, but Shona's point about having that mentor and finding the friend. I think that friend has got to be somebody that cares enough about you to tell you when you're doing amazing things and when they're not. So you need to find somebody like that. And the final point is sometimes you need somebody to keep you grounded and maybe check your ego sometimes. That friend needs to be confident enough to do that. And the final point, if I can, Anne, is to work on your bogus imposter syndromes as well as a leader. Try and find those mechanisms that give you that support, that give you that confidence to be able to grow. And very often that comes from somebody else, but very often you can undertake courses and work through some of that in a more educative way, I would say.
Wow, thank you to all of you. We have run out of time, but I don't want to go without saying thank you. You've been given some top tips from three fabulous leaders. So thank you to Shona, to Fortune, and to Paul. We could honestly, genuinely talk for hours and days on these things. It's remembering our humility, remembering that we are people at the end of the day who want to do as good a job, will make mistakes, but need to learn. And looking for that sweet spot, Paul, perhaps between having an over-eager imposter syndrome to having an ego. That's one of my takeaways today,
sure.
Along with Fortune and talking about some of those things that you go to. I've actually been hearing about Amy Edmondson a lot in the last couple of weeks, so thank you for that. And Shona, when it boils down to it, having a genuine critical friend who can tell you, yes, you're having a bad day, but you're doing brilliantly. And yes, you're having a bad day, but have you thought about this? So many things for us all to take away. Thank you to our audience for hanging in there. We're 1 minute over time. But Verena, an impossible task trying to corral all those questions, but thank you to all my colleagues behind the scenes. Our resources are on the website. We'll be continuing to promote them on leadership. We've got one out on holistic care, which a lot of things have been coming up in relation to holistic care too today. But final word, thank you, Shona. Thank you, Fortune. Thank you, Paul, for your time and your insight and your dedication and leadership of our professions. Really, really appreciate it. Thank you, everyone. We know we want to do more of these. Hopefully we will very, very soon. Meanwhile, stay safe, stay positive, and you are all leaders. Look at our resources, look at the code, look at the standards. Thank you, everyone, and have a good rest of the day.
Thank you. Bye.